In part two of our fracture conversation, this will look more at how fractures are treated, some primary nursing considerations, how fractures are healing or how they heal, complications of fracture repair or when they heal themselves, and how does smoking affect the healing of fractures. So those are the key questions for this video. First, how are fractures treated? Let me get out of the way here. Fractures, to start with the process, there has to be what's called good reduction. Reduction, if you want to think of reduction, reduction is we must reduce the distance between the bones. That is, we need to have the bones completely, the ends of the bones must be completely lined up so that when the fractures repair, they can then grow back together. So bone alignment is often necessary. If you have a closed reduction, the doctor is going to hold the ends of the bones and try to put them close to one another. It may be required to have surgery. We saw that video on the person with the facial fractures, and you saw ORIF, you saw open reduction. That means surgery was done to actually put the bones back together. So once the bones have been pushed and pulled and the alignment is good, then we can sometimes just cast that. Sometimes you have to see, as you see here, we must put in a device or an appliance. You can see here how the bone was fractured in a few places. So they put in this device to actually hold the bone in a few places. You can see this part of the bone was fractured right here. So that appliance is going to hold all that together. Now, what determines how well a fracture is going to heal? It depends. Is that a weight-bearing bone? Is the person older? How's their blood flow? How's their nutrition? So that healing process for a fracture is going to vary. You've heard of some people having bones where they can heal in 2 to 3 weeks. Sometimes you hear 6 weeks or 8 weeks or 12 weeks. It depends, again, on the severity of the fracture. If the bone is weight-bearing, which is going to require longer, of course, you need to build more bone tissue, and their overall health and nutrition are going to play key roles in how well that fracture repairs. Some key nursing considerations, things to think about then. If you are treating a patient who had a fracture, in this case we're looking at some form of leg fracture, probably a tibial fracture, you'll see the use of traction. They're going to pull, it's a little hard for me to show you on here, but this is a bag of weights. And this weight is actually going to be helping pull or keep that leg some pressure or some tension on that leg, so they'll prevent the muscle from kind of spasming and preventing the bone from kind of getting out of alignment, being unreducted, and therefore causing some damage to the healed bone. So traction is one way of mobilizing. Of course, the other is just, I keep getting in the way today. The other way, of course, is to just use a cast. When, obviously you've seen, oops, can't show you. My cast picture's gone. Obviously with a cast, we're going to have just a plaster of Paris or a fiberglass cast, and that's going to hold the bones in place while there's enough time for healing. So how does healing occur? There's going to be a step-by-step process how bone heals once there's been a fracture. So let's go through the first steps here. The first thing that's going to happen after there is a fracture, we're going to have all this blood is going to appear from the damaged blood vessels, and they're going to form a clot. And that clot's called, and I lost my marker again, that clot's called a hematoma. And it's not writing. I'm not sure why not. Okay, so a hematoma is going to be formed where you had the clot site. And because of the disruption to blood flow, you're going to end up with some cell death. Some bone cells are going to die. It's usually in that first 6 to 8 hours after injury. You're also going to, of course, have that fluid build up in the bone, and you get that swelling that makes it quite painful. The next steps to this, there you go. The next step is, this is going to happen again within the first day or so after the injury. You're going to start to get the appearance of new blood vessels are going to begin to grow in here. New capillaries, and I can't write anymore for some reason, sorry. New capillaries are going to begin to grow into this area, and they're going to bring in white blood cells. They're going to start removing the debris, the damaged cells, broken cells, dying cells. Fibroblasts from the nearby periosteum are going to come in, and they're going to start producing collagen fibers. That's what fibroblasts do. And eventually you're going to form the fibrocartilaginous callus. That is, and I'll try to use my pointer, you're going to form this callus, this kind of covering over this site here. It's a little hard to see, but this callus is the beginning of, it's kind of temporary bone. Fibrocartilaginous is going to, again, be the model that we're going to use to make new bone. So it's a little easier to see it here. We're going to get this this stuff in here. This is the bony callus that's replacing it. So the cartilage, which is again this purple stuff in here, the cartilage is going to be replaced by osteoblasts. Are going to move in. They're going to start producing the bony callus, and then we're going to convert that to bone. So as this callus gets replaced even further by more osteoblast activity, then more osteocyte activity, we end up with remodeled bone. The bone here is going to be even slightly thicker than before. You see a slight extra ridge to this. The bone has been reinforced by the extra activity of the bone, of the osteoblast rather, to make new bone. Again, how long does this process occur? It really depends upon the it depends upon the health of the person, how vascular it is, how much blood vessels were damaged. So that can all play a role in how long it takes to heal a fractured bone. Here you see that's what I mentioned before. It's a little hard to see, but it's an extra little bit of bone here. I can write again, yay. The extra bit of bone is there, kind of reinforcing it. So sometimes you can see somebody who had a fractured leg, let's say 10 years ago, and then you x-ray them 10 years later, and you still see an extra bit of bone there because of that activity that replaced the bone when it was fractured. So what are some complications? If somebody has a fracture, what are some of the complications, both early and late? Early and late are somewhat my terms, not as in early like in the first 5 minutes, but it can be earlier in the fracture repair versus later. Things like shock, and we'll talk about shock more in A&P too, but if you have a lot of blood loss, you can actually have organs begin to fail. That's what shock is. A fat embolism, you can have fat break off and enter blood vessels, and now you have this embolus, this piece of fat in the blood vessel, which could then travel to the lungs, to the brain, and cause issues. You can have compartment syndrome. Compartment syndrome, many people have not heard of this, but compartment syndrome is when you have, in a very tight space, usually in your lower leg or your forearm, you have an injury. Because of the tightness of the space, you have lots of, well, why is it tight? Because you have lots of fascia. C-H-I-A, fascia. You have lots of fascia in this area, kind of like connecting bands that go all around and kind of keep all your tissue together. It's not very flexible. So if you start to develop a lot of fluid in your broken arm or broken leg, and you get a lot of edema and a lot of swelling, you can have what's called this compartment syndrome rather, and that begins to kind of squeeze the tissues in there and can lead to tissue death. So that is a possible complication. Obviously, the risk of infection, clearly more so if you have an open or compound fracture, and DVT, deep vein thrombosis. It is possible that you could have a thrombus or a clot develop in a vein, and then it travels to wherever the lungs or the heart, or the lungs, heart, or brain once again. Other complications are sort of later. Delayed union. Perhaps it takes a long time for that bone to knit together, maybe longer than it should. That could be a complication. Avascular necrosis means that you have a lack of blood vessels, a lack of blood nourishment to an area. Necrosis is going to be tissue death. So If the blood vessels are damaged extensively and they are not growing back the way they should, then this tissue is going to be starved and will cause some death around the fracture site. Delayed reaction to fixation devices. This just means that we have put in screws or appliances and perhaps there's going to be a reaction to it, as in it's not aligned correctly, or the body's not responding to it and the tissue is not growing back the way it should. And then one more is called complex regional syndrome. This is a very difficult one to explain because we don't understand this one very well. But about 90% of the time, well, about 90% of the causes of complex regional syndrome seem to be due to trauma, fractures of arms and legs, that people then develop this lingering peripheral nerve pain. It's kind of hard to explain because we don't know why. Some people have the exact same injury and never develop this unexplained pain injury, and other people do suffer the injury and do suffer the pain. So it's not really well understood. There are some treatment options, but again, it seems to be a peripheral nerve issue and not really related to the fracture itself. And finally, how does smoking affect bone health? It seems like it would be kind of a stretch to talk about smoking and bone health because they don't really seem to be that connected. But actually, there's been studies that have tried to link the effect of smoking on delaying the healing of fractures. So multiple studies have in fact shown a significant difference. One study found that 95% of non-smokers healed completely from a wrist fracture within the allotted time. Only 68% of smokers did. So that's a significant difference. The average healing time for smokers was also 2 months longer. So it raises a question: why might bone healing be affected by smoking? Give you a second to think about it. If you think about smoking, smoking is going to affect oxygen levels as well as affect how well or how much blood flow actually gets to our tissues. So smoking causes vasoconstriction. It's going to cause some squeezing of blood vessels, therefore reducing blood flow to injury sites. So fewer nutrients get to these wounds. So that's probably why. There's not really hardly any benefit to smoking. Some of the smoking effects are clearly obvious in terms of lung cancer or respiratory issues. You may not have thought about this one, how smoking could actually interfere with wound healing, as in fractures. That's going to do it for this video. Thank you very much.